Get started then. The first thing on our agenda is our guest speaker. Initially, we had Patrick Schmidt. Schmidt. Okay. Was planning on doing our little presentation on mental health first aid. He had conflict on his schedule, and I lucked out and happened to be working with someone that works with Laura Larkin. And she called her real quick, and Laura was gracious enough to be willing to come and present to us. So I'm going to turn the floor over to Laura, and she can tell you a little bit more about herself. Do you want to stand or come back here and sit? How do you want to do that?
Excuse me, I have a whatever you want to call it. I'm on antibiotics, hopefully not contagious, but started out as flu and turned into something else. So I'll try not to be too disgusting with my nose problem. Okay, first of all, my name is Laura Larkin. I'm with the Department of Human Services. It's the Division of Mental Health and Disability Services, and we're the part of DHS that deals with state mental health policy and planning. So we work with the CPCs statewide is one of our duties, and then the other, I work in actually the Children's Division. So most of my job is focused on children's mental health development system statewide, just developing new programs and things for children. But another part of what I do is mental health first aid. And mental health first aid is also becoming a statewide initiative here in Iowa. It was brought to Iowa last year and also came to the United States last year from Australia. So as it's starting to spread nationally, Iowa has kind of been in the forefront of the states that have begun training instructors in providing mental health first aid. So right now in Iowa, we have about 46 instructors who can provide the 12-hour mental health first aid course. And I'm going to hand out a handout. And Lisa and I have been talking back and forth today about, do you have a PowerPoint? Do we need to do that? You know, and so our projector wasn't available and hers wasn't working. So this is our low-tech PowerPoint. So I'll pass those out. First of all, has anybody in here heard of mental health first aid? Okay. What have you heard about it? Or what is your
well, I remember when it was coming from Australia because I used to do CPC, so I remember Robin talking about it and how they had to culturally make some changes to fit Iowa and so forth. Dr. Parks was really big on bringing mental health first aid to Iowa.
And so, yeah, it's an unusual thing because I think we're all familiar with first aid and CPR. And so it follows that model in terms of providing the average person some information, some skills, some knowledge of how to interact with somebody who may be having a mental health crisis, which could include a suicidal crisis, it can include a psychotic break, it can include depression, anxiety. It's really focused on the person who may not have a lot of mental health training. So definitely below the level of a mental health counselor or a social worker, although there are a lot of skills that you can learn from this that are applicable whatever your job is. I'm a mental health counselor by training, and I've been through the course. Well, I'm an instructor in the course. So to become an instructor, you go through a week's worth of training. And then I've also taught the course several times, and I've learned things that, as a mental health counselor, I would use. So it's not something that mental health counselors have to have, but it can be helpful for really anybody, whatever their job title. But really what it's for is for the average person who may just be interacting with family members, friends, or the case manager who may not have a lot of mental health background or clinical background, but who's dealing with people with mental health issues every day. I recently taught the class to a group of substance abuse providers. And as we know right now, there's a lot of movement to bring substance abuse and mental health together since they've been so separate, even though we know that many people with substance abuse have co-occurring mental health issues and vice versa. So there's been this artificial separation that we treat them separately, even though if you don't treat one, the other will possibly get worse, or they're not going to get better independently. So there's interest in the substance abuse world for mental health first aid for those people who may not need the full clinical gamut of how to be a mental health counselor, but they need to know how to interact with somebody who's suicidal, how to interact with somebody who may be having a psychotic break, and how to know the signs and symptoms of what to do to get those people help. We talk a lot in mental health first aid about what the differences are in terms of when I say first aid, that doesn't mean, and I learned how to do CPR, that doesn't make me a heart surgeon. It just means that I know how to help keep that person alive and stable until professional help gets there. And that's what mental health first aid is. How can I help this person stabilize, find help, get to the appropriate person, to the appropriate professional, so that their life can hopefully be saved or preserved or improved until that professional help gets there. So there's been some resistance in terms of people, mental health professionals saying we don't want mental health first aiders out there thinking that, everybody's a counselor now. They don't want people thinking, I can diagnose, I can treat. I've taken 12 hours, I know what to do if somebody's, or I know how to figure out if somebody has depression or anxiety. And that's not what it's about at all. It's about information and knowledge and skills to help somebody who may be having a mental health problem get to the appropriate help. Because sometimes what we find out is people present a lot of signs and symptoms of suicide, of other major mental illnesses, and the people around them don't know. They don't realize that that's what that was that they were seeing until sometimes it's too late. They don't know that that person may be showing signs of suicidal thoughts or feelings by giving away their possessions, by not caring about things that used to be important to them. Just the things that they need to know in order to intervene. So anyway, so the goals of mental health first aid are on the second slide on here. And they're really the same for any first aid, mental health or physical first aid. To preserve life, to prevent deterioration, to promote healing, and to provide comfort. And so what people learn when they go through mental health first aid, they learn about the major mental health illnesses. So they learn about the most common ones that are I guess I'll say exhibited, the most common mental health situations that are found in the United States, which would be substance abuse, anxiety, depression, and eating disorders are the four major sections of mental health first aid. So they learn some pretty in-depth information about those things. And then they also learn an action plan of what to do to respond to crisis situations within each of those areas. And the action plan is talked about in here also. We'll talk about that in a little bit. But anyway, so again, mental health first aid, not counseling, not treatment. It's information, skills, knowledge, to help anybody learn how to interact with somebody who may be having a crisis. So we're asked, why are we doing this? Why do we think it's important? Why do we want more average everyday people to be trained in mental health first aid, people in the helping professions as well as people outside of that? Like I said, we're training substance abuse providers, we're training people who work in group homes with children, with teenagers. Schools are becoming very interested in mental health first aid, especially schools that have experienced suicides among their students. They're really wanting more knowledge that they can give their teachers and their staff on, what do we need to look for. And while mental health first aid is more adult targeted, it can be generalized certainly to teenagers, and eventually we'll develop a youth version, but for now it's really targeted toward adults, but it's generalized, I think, that you could use it with teenagers and in schools, and 2 schools in Des Moines that went through it and are offering it to their teachers and their staff. So the bottom slide just talks about why should we do this, why do we think it's important. Just that we know mental health problems are common, much more common than anybody realizes, that they can be treated, that people can get better, and also a big part and a big reason that mental health first aid exists is to help decrease the stigma, to help remove that stigma that people have in talking about mental health issues. That they really, they'll go to their doctor and talk about, I have a headache, I have a stomach ache, when oftentimes it's really about their mental health issue that is that underlying cause of what's causing their physical ailments. And as a medical professional, you may see that a lot. And one of the statistics, which I'm not going to quote word for word, but when they look at people who committed suicide, one of the things they find is that many of those people have seen their primary care doctor within a few months of their suicide. So they're still, it's not like they've given up on going to seek medical help. They're still going to that trusted medical professional.